New at 11, there's a change in the way we handle mental health in Hampton Roads. Today marks the beginning of the Marcus Alert system in Virginia Beach.
It's a different approach to standard policing, focusing on support for people going through a behavioral health crisis. Alex Littlehales tells us how it works and what will be different moving forward.
Crisis intervention has a different look in Virginia's largest city.
It's not necessarily that law enforcement is going to come out and respond. You could get a mobile crisis clinician.
Virginia Beach became one of 5 pilot regions in the Commonwealth to officially launch the Marcus Alert system Wednesday.
A behavioral health response to a behavioral health emergency.
Stacey O'Toole is the city's behavioral health director. She says starting today, a call over a behavioral health emergency will now trigger a new coordinated response between police and mental health clinicians.
Individuals in the community can contact 988, get a behavioral health clinician, because we're a Marcus Alert site, for our 911 dispatchers to have a direct line with 988.
Virginia Beach's Department of Human Services receives about 2,500 crisis calls a month. That number doesn't include calls made through police dispatch. Each of the 5 test regions received $600,000 in funding to get the Marcus Alert system up and running. That money from the state's Department of Behavioral Health and Developmental Services allows agencies to hire more behavioral health staff.
Virginia Beach is one city with one police department, which makes the logistics of that at least a little bit more simpler to navigate.
And the ultimate goal is to lower the number of crisis calls that eventually lead to hospitalizations or arrests,
so that their crisis doesn't escalate to the point of needing to be psychiatrically detained.
In Virginia Beach, I'm Alex Littlehales for 13 News Now.
The system stems from the case of Marcus David Peters.
He was shot and killed by Richmond police in 2018 while going through a behavioral health crisis.